I introduce the guest, I wanted to say that I got a letter on November the 3rd, 1978, and it says, "Dear Mr. Trotter, does anybody out there know that there are alternatives to doctors, hospitals, nursing homes, and rising medical costs? How many of your viewers are aware that chiropractic's foremost function is preventive health care, not treating necessarily whiplash and an aching back?" Well, got the letter from the Association of Chiropractic Education, and we are here this evening. Our first guest is Dr. Terry Rondberg, the author of that letter. He's president of the Association for Chiropractic Education and is a doctor of chiropractic. Next to him is a medical doctor, Dr. Jerome Williams. He's director of the Williams Clinic in St. Louis. And next to me is Dr. You know, it's funny, Reginald, usually all the guests are on one side. I'm wondering who's next to me now. Is Dr. Reggie Gold. He's a doctor of chiropractic and president of the Institute of Straight Chiropractic in Pennsylvania. I think that's Adio, okay. And last but never least is Dr. John Grant. He's a St. Louis physician. 367-7211. We have a new little format here that I am eventually going to get comfortable with. Let me say that I think it's very important when we had a show, when we thought about this, when Terry said, well, what about us? A great idea, I thought. Still a great idea. The show was almost going to be canceled because we didn't have an opposing viewpoint. Not necessarily an opposing viewpoint for the sake of being mean or evil or pro or con, but for a moral and legal sake. I think when you talk about health, it's the most important thing there is in life. You can be black or white, poor or rich. You can be a Republican, you can be a Jew or a Gentile. When it comes to good health, when it comes to health, it's very important. It's essential. Therefore, in an effort for health for you, good health for you, for questions such as chiropractic, you always have to have another opinion. And that's the medical opinion. The medical world, the world of medicine, the world of surgery. Therefore, on this evening's show, I think you will find that not only the show will be enlightening, informative, which it's supposed to be, but most importantly, you will get several contrasting opinions, and it's left up to you to decide which one you want to believe in. 367-7211. Terry, I think I would like to ask you, what is chiropractic?
Well, to answer that, I think it's essential to have an understanding of what chiropractic is not. Chiropractic is not a diagnosis or a treatment for any disease or any symptom in any way at any time. And I think that the vast majority of people do not understand what chiropractic is or what it's for. Chiropractic is for the restoration and maintenance of health.
Okay, I have a brochure, and it is from your organization. It says people come here for 4 main reasons: disease, prevention, improving themselves, and improving the world. Can the medical world offer the same thing, in your opinion, Dr. Jerome Williams?
All right, welcome back to Chiro Philosophy mixtape. So that was the first clip of the debate of the MD versus DC classic debate, 1979. And I just want to say before we get into it, the moderator, Gentry, bro, this guy had the look. He had the OG player, leave your rollers in, Little Richard, perm going on, man, with the aviator style glasses, 3-piece suit. Man, you couldn't tell these 70s cats nothing, man, like just styling. All right, so what the chiropractor Dr. Terry Rondberg said in the beginning was a beautiful statement explaining what chiropractic is not versus what they think chiropractic is. as I feel like society gets that mixed up all the time. As he said, chiropractic is not to treat or diagnose any diseases. It's to restore health. And I think what he said was a perfect statement to hit the ground running with. And and also what Gentry, the moderator, was saying about from a chiropractic organization, the top 4 things that it can do. It was really 3 things where he said 1 is disease prevention, 2 is to improve patients' lives, and 3 is to improve the world. And he bounces that question to the MD, Jerome Williams, Dr. Jerome Williams, on if he thinks medicine can do the same thing. All right, so let's get back to it.
Oh, very definitely so. I am still not quite clear as to what the practice of chiropractic actually is, and I think this will be a learning situation for everybody. Now, I would like to differentiate chiropractic from chiropody. The public probably, I guess those confuse the practice of chiropody or podiatrist actually is dealing with the feet or the foot itself. This goes back to 1840, and I think the chiropractic first started in 1895. I think they had David Palmer who founded the organization in Davenport, Iowa, and he established the Palmer Institute or Palmer College of Chiropractic in 1898, and his son carried on the work. But I would like to hear more what the gentlemen have to say about exactly what they do, so then I can more intelligently comment on it.
Okay.
All right. Dr. Jerome Williams. So that was the MD. I was impressed that he actually knew the history of chiropractic and how it started. Like he named the creator of it, D. Palmer, and his son, Dr. B.J. Palmer, and how they started the Palmer School, and he referenced 1895 when it was created to 1898 when they started the school. I was like, all right, now he did his little research. All right, MD. So but he did say he still wasn't sure of what chiropractic, like the full scope of it is, and he said he would like to know. So let's see what the rest of the panel has to say. Let's go.
Dr. Gold, you may continue with that by the specimen you brought in.
Okay, if I may borrow a little Willie here. This is a fiberglass model of the human spine seen here from behind. The hip bones or pelvis, the sacrum, tailbone at the bottom, then the 24 movable segments or vertebrae that form the spine, and on top of that, the skull. This, of course, is the province of the chiropractor. Chiropractic is based upon the intent of keeping these bones in their proper relationships to each other, simply because virtually every vital nerve trunk in the body passes through these openings. As we turn the spine sideways, we see openings between the bones, and inside the bones of the spine runs the spinal cord. Now, as long as these bones are in their proper relationships to each other, then all of the nerve trunks, giving rise to all of the distribution of nerves throughout the body, is in a normal, healthy condition. The nerve trunks are in a normal, healthy condition. If, however, one of these bones becomes misaligned from its fellows above and below, that's what the chiropractor calls a vertebral subluxation, a tiny twisting of the bone, which narrows the opening, damaging the nerves, and resulting in some malfunction or malfunctions at the organs at the end of the nerves. Now, the chiropractor's job is, as Dr. Rondberg pointed out earlier, is never to diagnose or treat disease.
All right, now, so that was Dr. Reggie Gold, the chiropractic legend. And I just want to point out his look as well. He had the little fro going on with the mutton chops, you know what I'm saying? He didn't have pork chop sideburns. He had the mutton chops. I kept my sideburns right there just for this. But yeah, and I just had to bring it up too. He named his spine model Little Willie. Like, that's so hilarious. Like, but yeah, he definitely embodies chiropractic. And he was just, explaining what a chiropractor does and why they're examining the spine in the first place, and explaining how these bones of the spine are articulating with one another, and how, you know, how the nerves come out of the openings of these vertebrae, and if there is a misalignment above or below one of these vertebrae, then it leads to that malfunctioning of that nerve tissue that leads to an organ in the body. And I feel like he, you know, explained that to a T, to like elementary school level almost. That's where most people would understand that, right? And so yeah, that was great. So let's continue.
So what we're doing then is examining the spine to find these subluxations, and we examine the spine with x-rays, with instruments, with our hands, and if we find a subluxation, then we set about a program really of spinal rehabilitation, gradually, gently easing these bones back into their proper relationships, getting the openings back to normal size, and allowing the nerves to function normally. And that's all.
Okay, in your, I could say, treatment of this, if someone has, let's say, a bad back, do you check that out before you go to twist the nerve?
Absolutely not.
Is that dangerous?
No, we will examine the spine to see, first of all, if there is or is not a vertebral subluxation. We really don't care what it's causing. We're quite satisfied that any time a nerve is damaged, then the entire body must suffer as a result.
You don't care what it's causing?
No, exactly. If there is a vertebral subluxation, whether we can find what it's causing, whether we know what it's causing or not, in and of itself, this vertebral subluxation limits the body's ability to function properly. It shouldn't be there. So the next part of our examination is concerned with seeing whether it is safe for the chiropractor then to adjust the vertebra back into place.
Hey, welcome back. So yeah, that was Dr. Reggie Gold. Again, just giving some more detail into what we actually do when we are, you know, examining the spine, and, you know, where we lay our hands on the spine and we use x-ray imaging and instruments like thermography, for instance, to see if this patient actually has a vertebral subluxation. And so where the moderator Gentry was saying, oh, so you don't care about my back pain, you know what I'm saying? Like, it's not that we don't care about where your pain is coming from, but if you were to point to your pain, you're gonna expect us to adjust you where the hurt is, which you know is logical, but that's not the case, because pain travels, especially in the nervous system, right? So does that make sense? So we gotta find them subluxations. So we gotta find the root of that pain, and not even that, like, because the detection of a vertebral subluxation is not pain centric. It is neurology based. So we're tracing it back to the root of the nerves. So that where it goes into healing, where the healing takes place, where you may feel instantly better after an adjustment, where sometimes you may feel worse right after the adjustment, or sometimes you may not feel any, or you may just feel the same after the adjustment. But if the subluxation was corrected, then you gotta expect healing to take time, which is part of that chiropractic education. So Dr. Reggie was on point with that, and Gentry was doing his job as well with the slickness there. I caught that. So to catch him off guard, but yeah, that's what's up.
The spine. Now, you say the orthopedic surgeon can't do anything about it, but you can. Now, that is where the chiropractic and the medical men differ. The subluxation, we feel that any pressure put on the spine, on the nerve, actually produces damage to the tissue itself, but it's readily recognizable by a certain location of that spinous process.
Well, you say
Now,
that in one
can you
breath.
tell me what subluxation that you're describing is that produces pressure on a nerve and yet produces no actual symptoms?
Oh, you have just described it. You have just described it yourself. In one breath, you're saying we recognize it and we can certainly get rid of it, or orthopedic surgeons can. And a little while earlier, you said there's no validity to the practice of chiropractic, which is what you are now claiming orthopedic surgeons are doing. You see, when chiropractors started doing this, orthopedic surgeons were the ones who said there's no validity, there's no such thing as a misalignment of the bone damaging nerves. Now they're attempting to do that, which a few years ago they said couldn't happen. There's a whole new branch of orthopedic medicine now trying to imitate what the chiropractor does, a branch called physiatry. And they manipulate the spine to correct these subluxations. They're not very good at it. It's a part-time job for them. They're not full-time professionals at it. But that's what chiropractic is.
All right, so welcome back. That was a clip of Dr. Jerome Wallace challenging Dr. Reggie Gold and questioning, so you're saying that an orthopedic surgeon can't take the pressure off a bone like a chiropractor can. And mind you, Dr. Jerome is an internist. He's in internal medicine. He's not a surgeon. And yeah, that's the point where he's saying that, an orthopedic surgeon can go and find a pressure on the bone where they can, see inflammation off the spinous process, what have you. Okay, but it doesn't mean that a patient should immediately go under the knife and have surgery done. Where Dr. Reggie is explaining that chiropractic should be the first approach. It should be the first line of defense, the most conservative approach to address that spinal issue going on. And Dr. Jerome was questioning, like, how can you find these vertebral subluxations without symptomology? And that's the secret weapon that chiropractic has, to where, that's the thing. It's not it's not symptomology based. It's neurology based, like he was saying before, how you have the brain cell trying to communicate with the tissue cell, and they do that through the nervous system. And when you have disruptions or blockages in that's called subluxation, where it doesn't necessarily have to be physical. It's called the 3 T's, where you can have thoughts, trauma, and toxins involved. And so that's the science, the neurology that Dr. Reggie is referring to, that I feel like medicine today is catching up to, with more functional neurology being accepted. But back then, definitely not. And Dr. Reggie even brought up, physiatrists performing manipulations on patients where they're just setting the bone or moving the bones. They're not doing chiropractic adjustments because they're not looking for the vertebral subluxation in the first place. And explaining, like, that's the difference between what we do and what y'all do. Get it, got it, done. So that was a good back and forth there. All right, everybody, we're gonna stop the show right here as the ending of part 1. Be on the lookout for part 2 of MD versus DC classic debate in 1979. You know what was going on in 79 though? So in 79 in pop culture, you had Michael Jackson come out with Off the Wall. You had Pink Floyd come out with The Wall. Is that the name of it, their project? But yeah, Pink Floyd came out with a project that year. You had some disco stuff happening. And you also had hip hop, the birth of hip hop in 78, the year before. And you had a lot of political stuff going on as well with terrorism and all that. So 79 was right before the 80s, so it's a very interesting year. So yeah, we're gonna end it here, and be on the lookout for part 2. All right, peace.